George, and thank you. Welcome. I'm Nicholas Miller, but I'm only part of a much wider team of Dr. Deborah Kirby and Edward Hall, and working very closely with quite a number of you in this room. And what I'm about to share with you in this presentation is very much a personal perspective. It's a perspective and insights that have been built on a lifetime of working in the field of health innovation since the 1980s, which was when I first came to Jordan to introduce the world's first genetically engineered vaccine. And then went on to work with the World Health Organization on the Children's Vaccine Initiative to see how we could extend those ideas to create a whole new generation of vaccines that would ultimately transform the whole field of public health. I've also worked with the World Health Organization on their orphan diseases, particularly looking at hemorrhagic fevers. And sometimes that has worked, and there have been big successes with the emergence of the Guardian Global Alliance for Vaccines and Immunization, and sometimes we've been behind the wave, as you will all remember when we had the Ebola pandemic in West Africa, which we had been trying to prevent for many years before. More recently, I've been involved with the Global Outbreak Response Network. But the most exciting thing has been the last few years where I have been involved in innovation in this field, particularly working with amputees themselves, putting them at the heart of the innovation process. And that has led to some really amazing breakthrough products designed by amputees for amputees. One of those people is Alex Lewis. You can see him in this seminar that we're running, looking specifically at innovation in this field in Ukraine last year. And he's also been a key part of some of the service delivery programs that I've been doing, where we have always tried to include an amputee who could talk with authority and authenticity, particularly when one is dealing with people who are possibly at the start of that long and sometimes difficult and dark rehabilitation journey. And his very presence and sharing their insights along that journey can provide hope and inspiration in sometimes difficult times. And talking of difficult times, we're facing a challenge the like of which none of us have witnessed before. The crisis in Gaza with an extraordinary number of injured people. This is the latest data from last month of over 101,000 casualties. Now I want you to look at two segments on this chart. The first is the yellow one, and this is from the Ministry of Health and the World Health Organization, and this is casualties that we know very little about. So almost half the people there, we just don't know what is happening. We are in the blind about this, and we have to remember when we're thinking about this that we've got to listen and understand what's going on. The second segment of that pie chart I want you to look at is the blue chart. Those are all children. And when you think back on your professional careers, you'll think that this is a sector that has really been driven by the need for adult prostheses. And it is not set up to respond to the particular challenges of children, and particularly on the scale that we are seeing in Gaza right now. So this is a huge challenge for us, and we can't look back in the rearview mirror. We've got to look forward. We've got to work collectively to imagine a better way, a better solution, better services. Earlier this year, on the 11th of June, Jordan hosted a very important meeting. His Majesty and the government of Jordan brought together many countries from the international community for a humanitarian summit to consider how we could work together more cooperatively and more effectively in responding to the crisis in Gaza. At that meeting, Dr. Hanan Balki, regional director of the World Health Organization, stood up to highlight the importance of medicine. And she highlighted the importance of two things I want to share with you. The first, that actually we need to be ready to think outside the box. And the second is that we need to think within the region and to build capacity within the region. And with those words ringing in my ear, I want to congratulate the organizers of this regional conference, the first ever Arab regional conference, because it comes at an incredibly important time for the region and demonstrates, I think, the vision that Dr. Hanan Balki was talking about when she addressed that conference. So what are the hallmarks of appropriate innovation? What do we need to do when we're thinking about tomorrow's solutions, particularly in the light of how we build on standards and the work that Claude has been talking about earlier before? Well, here are four very important hallmarks, I think, by which we can judge whether something is good or perhaps even great. The first recognizes that it's got to be tailored to the individual. Every man, woman, and child is unique, and their needs will be unique. The second point is that we need to act quickly. Rehabilitation starts at hour zero. And ideally, we would have the solutions yesterday, but we don't. So today and tomorrow is when we need to start building and working on these. We need to make sure that they're accessible. And I'm going to talk a little bit more about that they're adaptive, because we really don't know the environment, and the situation that we're dealing with is changing all the time. It's going to be evolutionary. We want one innovation to build on the next, so that in a few months' time or a few years' time, we'll look back in astonishment to see what we've kind of been able to create. It needs to build on the ecosystem in the wider region, and it needs to be sustainable and cost-effective. Now, I want to share those ideas. All seem to be hugely difficult, but I want to share with you the story of Yazam and something that Jordan has done that is simply incredible. A few months ago, Yazam was wheeled into the Royal Medical Services clinic, a triple amputee in a strike that had actually disabled his entire family, and he had lost 3 limbs. Within 24 hours, he was standing and taking his first step. Now, if I had shared that with you 3 months ago, I would have said myself, impossible. But as one of the Royal Medical Services team said to me, he said, "Nicholas, we're Jordanians, anything is possible." And I loved that story. And right now, Yazam is helping his family, and he's pushing his father around. His father, sadly, is still in a wheelchair. But yeah, Yazam is a key part of the family, looking after that family unit, and actually has begun his first few steps in a new life. Now, that was in the Royal Medical Services Centre, this National Centre of Excellence here. How do we make that available? How do we make that accessible in the harsh conditions of Gaza? And this is simply a watercolour of a mobile clinic. It doesn't exist today, and the security challenges that we've got in Gaza means that you can't drive around in amongst the communities, amongst those that need them. But wouldn't it be better if instead of those in need of prosthetic services having to travel to some centre, that centre went out to them and we turned the model upside down? I think we can do that. And we're going to do that collaboratively and together. Now, Claude was talking about the ecosystem, and I don't expect you to read this slide. I want to appreciate it that it is messy, and it's actually changing all the time, and it involves a large number of people working together across different cultures. This is actually the ecosystem in the UK, and it involves all sorts of people with different priorities. And we need to be able to work within that flexibly and draw people together, draw on the best insights and the best research, build the evidence base, and the most imaginative companies, and come up with new solutions. We also need to think about how we make it more sustainable, how we build back better, how we fit into the circular economy of tomorrow. Now, I'm not going to, Deborah could explain the concept of the circular economy much better to me than I could, but this is the idea that we actually create less waste, and through designing better, more sustainable products and services, we can actually bring the cost down with more recycling, more refurbishment, and actually this creates local jobs within the community, within that region. Now, I want to come back to costs and cost effectiveness. The cost of the product is just the tip of the iceberg, because most of it is then the follow-up, the clinical services, the support needed to last a lifetime. And you may say, well, these costs are huge, how do we cope with them? Well, I just want to raise the counter-argument of what the opportunity cost is of any delay, of not giving someone the best possible solution that we can today. That's prolonged suffering. We undermine the long-term outcomes. We exacerbate the burden of care on the family and in the communities. And most of all, we undermine that most precious resource of all, of hope. So we've got to change the conversation. We've got to use cost-benefit analysis to show the benefits of providing the best possible solution at the earliest possible time. And that is something that Deborah and I are working on, and we'd love to collaborate with any of you with your ideas as we seek to change that conversation about the investment in making a better future for these people. And all this is brought together in an initiative that involves several of you around this room, and I would at this stage ask you to stand up, Edward, Deborah, Brian, Stuart, Amna, who are all working together on this program. We want to bring you into the tent as well and work as collaboratively as possible across the region. And with that, I thank you for your time and thank you for your support. And if you'd like to know more, take out your smartphones, shine it up onto the screen, and that will take you to a link where there's not only the latest information in terms of what the teams are doing in Gaza, but also on expert briefings, and we would love your thoughts and your feedback on this. Thank you.